One. Hi, this is Kendrick Allen, Compass Pointe Counseling. We're an outpatient facility on the outside of Atlanta, probably about 15 minutes from downtown. Today I want to talk about families in recovery and why it's imperative that family members who is connected or involved with the drug addict and alcoholic, why it's imperative that they seek treatment. And so we're going to follow this formula with, we do consider the disease of addiction an illness. It needs to be treated, and some of the concepts or characteristics of an illness is that it's chronic, it's progressive, it needs treatment, meaning it's not going to go away like the common cold. It must be treated medically and psychiatrically with some really good intervention. It's potentially fatal, and in some cases, probably about 45 to 50, 52% family members have this addiction as well, and so we can say there's a genetic component to it. Because we have this illness, the person is going to exhibit symptoms. That's why we know something's wrong. So symptoms is not a bad thing. Symptoms just indicate that something's wrong. And so we have the symptoms coming out, and then from the symptoms, the patients are going to have a certain amount of behaviors or thoughts that's coming directly out of the symptoms, that's coming directly out of the illness. And if they exhibit and act on these behaviors and this thinking pattern for a long period of time, they're going to develop certain habits. Now, in treatment, our focus is going to be minimizing symptoms. And so we're going to get the patient from becoming symptomatic to becoming asymptomatic. And our focus is going to be in this area here of how do we start to change the thoughts and the behavior of the patient, hence improving their habits. And so we have patient here, patient experiencing symptoms, patient having the behavior and thoughts that come out of the symptomatology, and then exhibiting habits, negative habits that's coming directly out of the thoughts and the behavior. And so we have the family members understanding too that there's an illness, they're part of it, they're connected to the patient who's connected to having this illness. They're going to have a response to the patient's symptoms, meaning they're going to react to it. And every time the patient is acting out on their behavior, the family members are also going to have a behavioral reaction to the patient's action. And then the family members can develop certain habits that goes along with reacting to the patient's behavior for a long period of time. And so what treatment is doing is actually extracting or taking the patient out of that system where we're minimizing or diminishing the symptoms. We are getting them to change their thoughts and improve their behaviors, because you can have addictive thinking as well as addictive behavior. So we just don't want to stop the addictive behavior, we want to stop the addictive thinking, and hence changing their habits. Now, who's left on the board here? The family members, the spouses, the children, the parents, the significant others. And since they've been exposed to these symptoms, they're also going to have to get some intervention, because they're going to continue the same types of behaviors and thinking patterns and having the same habits that they were having as if the patient is still using. So there must be family intervention. Statistically, about 50% of the family members have shown up with significant symptoms of depression just being exposed to the cycle. And so that's imperative why family members must seek treatment along with the patient. And so now the relationship, the family is going into recovery, just not the patient. Thanks.